Hello and welcome to CPR Heroes. This channel is aimed at empowering you with techniques to assist a family member at home with a medical emergency. Brain damage begins within minutes after a non-breathing child goes unconscious, and immediate CPR can make the difference between a complete recovery, a lifelong disability, or even death. My name is Daniel Joseph. I am emergency first responder instructor number 194912, and today we'll be covering how to save the life of a non-breathing unconscious child through child CPR. If you have not subscribed to this channel, please click on the subscribe button, give this video a thumbs up, ring the bell, and share this video because this information can save the life of someone very dear to you. This video does not certify you as an emergency first responder. Therefore, I highly recommend signing up for a complete certification in emergency first response through the link in the description below. If a child is unconscious and you do not suspect spinal injury, look out soon for a video on spinal injury. Turn them on their back and use the AB CAB's priorities to assist. A for assess the scene, alert EMS, apply barriers, and airway open. A. Assess the scene. Ensure it is safe for you to help without getting hurt. This is also a good time to stop, think of what to do, and then act. We will discuss scene assessment in depth in another video. Alert EMS. Call EMS immediately or have someone else call if you haven't already. Apply barriers. Barriers like gloves, eye shields, and ventilation masks are used to prevent you and your family member from transmitting blood-borne pathogens and other infections to each other. We will go more in depth on barriers in another video. In this scenario, I am resuscitating my daughter and I am comfortable performing CPR on her without any barriers. In most cases at home, you may feel comfortable resuscitating your family member without barriers. Airway open. Use the head tilt, chin lift method to open the airway. This is done by first placing your hand, which is closest to their forehead, on their forehead and gently tilting the head back while positioning the index and middle fingertips of your other hand under the point of the chin and lifting the chin to open the airway. Note, if this is following a choking incident, first look inside the mouth for the obstruction and remove it if it can be seen. Be careful not to push the object deeper as you do so. B. For breathing normally. Now check for breathing by placing your ear and cheek directly over the nose and open mouth while looking at the chest and still holding the airway open. Check for normal breathing by looking for chest movement, listening for breathing sounds, and feeling for expired air on your cheeks. This check should be done for no more than 10 seconds. C. Chest compressions. Locate the chest compression site. This is done by putting the heel of one hand in the chest center. On most children, this position is between the nipples. You may expose the chest only if necessary to find the compression site. Using the palm of one hand only on the compression site and fingers off the chest, deliver chest compressions by positioning yourself so that your shoulder is directly over your hand and your arm is straight. Keep the force of the compression straight down. Avoid pushing on the ribcage or the lower tips of the breastbone and allowing your body weight to deliver the chest compressions. To provide effective chest compressions, you should push hard and push fast, depressing the breastbone approximately 1/3 the depth of the child's chest, which is about 5 centimeters or 2 inches. After each chest compression, release, allowing the chest to return to its normal position. Repeat this at a pace of 1 2, 3, 4, and so on, counting fast for 30 compressions. Perform the chest compressions as fluidly as possible. Your rate should be 100 to 120 compressions per minute. Ensure that you do not interrupt chest compressions for more than 10 seconds. A. Airway open. Use the head tilt chin lift method to open the airway. Again, if this was following a choking incident, I will look inside the mouth before going to the next step, because there is a high possibility that the chest compressions may have expelled the obstruction. If the obstruction can be seen, I will remove it, being careful not to push the obstruction deeper as I do so. B for breathe for your child. With the head still tilted back and your palm still on the forehead, shift your hand closer to the nose, pinching the nose shut with your thumb and index finger. In today's example, I will be giving mouth to mouth without any ventilation barriers, since I'm resuscitating my daughter and I'm comfortable giving her mouth to mouth. Note, if you are not comfortable giving mouth to mouth, chest compressions alone is very beneficial. Look out for the upcoming video on barriers. Now give 2 rescue breaths, allowing about 1 second for each ventilation, and provide just enough air to make the chest rise. Look for the rise in the chest. If you can't make the chest rise with the first breath, repeat the head tilt chin lift method to reopen the airway before attempting the second breath. Improperly opening the airway is the most common cause of not being able to inflate the lungs. Do not try more than twice to give rescue breaths that makes the chest rise. Minimize delay between chest compressions. After 2 breaths, whether they make the chest rise or not, continue with the cab portion of the mnemonic, which is give 30 chest compressions, again followed by 2 rescue breaths, following the same steps mentioned, and continue alternating the cycle until any of the following. 1. EMS arrives. 2. You can defibrillate with an AED, which is an automated external defibrillator. More on AEDs in another video. 3. Your child becomes responsive and begins to breathe normally. 4. A trained person takes over CPR efforts. And 5. You are too exhausted to continue. Take special note of the following 2 points. 1. We do not take time to look for a pulse. Studies show that even healthcare providers have difficulty detecting a pulse on unresponsive patients. Checking for a pulse takes too much time. Instead, immediately begin CPR if your child is unresponsive and not breathing normally. 2. Never practice CPR on another person. I did the chest compressions on a stuffed backpack, and you may use something similar. 3. Child CPR involves 30 chest compressions first, followed by 2 breaths. 4th, the S in the mnemonic AB CABS stands for serious bleeding, shock management, and spinal injury, all of which CPR takes priority over. Look out for the follow-up videos on serious bleeding, shock management, and spinal injury. Thank you for watching this video. Remember, if you have not subscribed to this channel, please click on the subscribe button, give this video a thumbs up, ring the bell, and share this video. You may also sign up for the Emergency First Response course by following the link in the description below for complete certification. This has been Daniel Joseph, Emergency First Response Instructor number 194912 with you. Till we see in the next video, Yahweh bless and keep you. Shalom.